Welcome back, everyone. A snoring partner can mean very little sleep and frayed nerves, and in some cases, serious health issues for the snorer. Sleep experts say that more than 22 million Americans have obstructive sleep apnea. Advances in orthodontics, though, are helping to treat that condition. And here with more is Dr. T from Smiling Heart Dentistry. Welcome back.
Thank you very much.
How are you? I had no
Wonderful.
idea. 22 million people is a lot. That's a pretty big percentage, and it's men and women and even kids.
Children are now starting to have much more sleep apnea.
Do we know why?
Main causes is allergies, and I'll go into the reasons why allergies can cause sleep apnea. And most people are actually undiagnosed sleep apnea patients. We don't even know that they have it.
Especially if they're sleeping in a room alone, maybe nobody hears what's going on. So what exactly is sleep apnea?
So sleep apnea, we're actually today going to talk about obstructive sleep apnea, which is the most common sleep apnea. And just like the name says, it's about obstruction. And when your throat is obstructed, many times people stop breathing, many times 30 times in an hour. And that can be for extended seconds.
Well, what is obstructing their airway?
That's a great question. Most people don't know about the actual answer. Basically, the airway, in front of the airway is your mouth, and inside your mouth is your tongue. So the topic about today for me is to educate about how the mouth and the tongue plays a role in sleep apnea.
In doing this. Okay, and so there's a pretty distinctive sound to the sort of snoring that goes on where people are actually stopping breathing periodically. So let's listen to that.
So this is snoring, and usually that's caused by obstruction of your throat. But many times you hear this, which is nothing. They stop breathing. And the problem with that is obvious. You don't get enough oxygen. And what happens when you don't get enough oxygen is your brain wakes you up saying, hey, I need some oxygen. So what happens if you keep on waking up at night? You don't get deep sleep. And that's the most healing sleep, and your body doesn't get to recover from stress over the day.
So you're never rested, you're never really recovered or refreshed by your sleep. Are there other health problems that can emanate from that?
You know, I think a better question would be what other problems are not related to sleep apnea?
Okay.
Because there's a list of sicknesses that come from sleep apnea. In fact, there's a new research that shows that cancer many times can aggravate, or sleep apnea can cause cancer or make it worse, and many times the treatment for cancer might be resistant because of sleep apnea.
Wow.
Other health effects: diabetes, heart attacks, strokes, Alzheimer's, acid reflux. 60% of the people who have sleep apnea, they have acid reflux.
So there are plenty of reasons to want to do something about this. Okay, there's something called tongue tie. What is that?
So talking about the reasons why we have sleep apnea patients, many times the main reason is a small mouth, which causes the tongue not to have enough space, which goes inside pushes the tongue back into your throat. So tongue tie like this, and people should notice this from the day they are born and treat this condition, because when the tongue is tied down, it doesn't go where it belongs, which is on the roof of your mouth, and stimulate your mouth to grow. And so people who have tongue tie, many times they have a small mouth.
Interesting. Does that relate also to mouth breathing, or is this a separate problem?
So that's a separate problem, but many times the tongue tie can cause your mouth to be small, which can cause your nose to be small, which can cause for you not to be able to breathe through your nose, which can cause sleep apnea.
All right. So what are the traditional treatment options for this? I've heard of the CPAP machine. Lots of people use this.
That's the most common treatment, CPAP machine. There are other treatments like jaw repositioning devices, which moves your jaw forward to open the airway because your tongue is in the way many times.
So it's almost like a night guard that you wear?
Yes, that covers the top and the bottom. And then it comes to more last resort technique, which is surgery, which many times they would have to cut your jaw and reposition it forward. You can see in this picture, a person had a jaw repositioning treatment. It's a very aggressive treatment.
Yeah.
I wouldn't say everybody should get it. In fact, we can do many times what the surgery can do without surgery.
With appliances or with other approaches?
With special approach called there is a thing called orthodontics and orthopedics. We treat both. We actually make your bones to grow, the jaw bones. And this is not just for kids. We can make the jaw of an adult grow. If you can be 5 years old or 95 years.
Really? How do you do this?
It's called epigenetics. So most people are created beautiful. The environment can cause them not to be so. For example, the allergies. And so what we do is we wake those genes up and make the jaw start to grow to where they were supposed to grow. And that, all of your teeth have stem cells. That's why you can move the teeth. So does your lower jaw have stem cells in the condyle. So you can actually grow both the upper and lower jaw with the help of the teeth.
And that gives you a deeper area for your airway, or what are we trying to accomplish as we look at this?
So we're looking at some pictures where the patient's lower jaw and the upper jaw, in fact, within 6 months, we grew the jaw by 7 millimeters.
Oh.
The upper jaw grew and the lower jaw followed, and you can see the angulation of the lower jaw is more forward. Not only does this affects the airway, but it makes you more beautiful to the full potential that you were supposed to be created. In this patient, not only we had a issue with airway, but the main concern for the patient was headaches. When you have smaller jaw because of issues with breathing or tongue tie, you can develop muscle problems, and 90% of the headaches come from muscles. So with the help of special orthotic, her jaw was put in a position where she is most relaxed, and her jaw was grown also 7 millimeters within 6 months.
And did the headaches go away?
The headaches went from severe daily headaches to almost none. And she used to have numbness in fingers that disappeared. She's having a normal life now.
Wow. Tell me about this little bit of medical technology here. What is this for?
So when I said most people are undiagnosed sleep apnea patients, that's because it's not that easy to be diagnosed. You have to go to sleep center, sleep in a strange place, hooked up with many things. To make it easier for patients, this is a device that they can take home and put it on the finger in one spot on the chest. And the next day they bring this back, and the sleep doctor gives them a diagnosis within a couple days.
It collects the data.
Yes, and we transmit it.
That is much easier than going to a sleep center. Thank you very much for letting us know. I'm glad there are things that people can do to help. That sounds wonderful. For questions or to schedule a visit to see Dr. T, you can find more online at smilesfromheart.com. We'll keep it on our website as well. Coming up, a new program aimed at reducing the number of C-sections. We'll have more on that after this quick break.